Namaste and a very warm welcome to everyone present here. I'm Dr. Adira Mohan K, the founder of Amogatrayi Wellness and Coaching Institute, an ISO certified educational platform that unites Ayurveda, modern diagnostics, and functional nutrition to empower health professionals across India and abroad. So at Amogatrayi, our vision has always been clear to bridge traditional Ayurvedic intelligence with modern clinical clarity and to help practitioners rediscover the precision and confidence that classical texts truly offer when decoded in today's context. With that same vision, we created Prabodha, Awaken Your Clinical Clarity, a signature initiative designed to help doctors go beyond rote learning and experience Ayurveda. And today, it gives me immense joy and honor to begin this introductory session of Prabodha in the esteemed presence of a visionary in our field, Dr. Saifuddin Gurukal P. Medical Director of Ali Gurukal Shafi Ayurveda, HOD and Associate Professor at KMCT Ayurveda Medical College, Calicut, and one of the India's most respected experts in Mama Chigilsa and Shalyatantra. Dr. Saifuddin Sir's contribution to Ayurveda from innovative clinical practices in fracture and dislocation management to his nationwide workshops and CMEs reflect the very spirit of Prabodha, blending classical depth with clinical mastery. On behalf of Team Amogatrayi and our growing family of Ayurvedic doctors and learners, I extend a heartfelt welcome to you, sir. We are truly honored to have you grace this platform and share your wisdom with us. Let us begin this enlightening journey of Prabodha, awakening clinical clarity with deep gratitude and enthusiasm. Thank you so much. Over to you, sir.
Namaskar to all. Yes, very good evening to all, dear doctors and researchers, practitioners, even students. Everyone will be here, I hope. And this is the one of the platform to share the knowledge. Whenever you are getting doubt, you please note it somewhere else or else put in the chat box. Whenever we have, once we finished our discussion and the theory, then we'll go for the another questionnaire session. So that time we can clarify that. Actually, we all are knowing about the anatomy as well as the how to read the X-ray, how to read the MRI, everything, how to prescribe also. But somewhere we are getting doubt. Am I audible now?
Yes, sir.
Yes. So whenever we are getting doubt, how we are getting doubt? Usually the difficult area, sometimes the patient is having pain on different areas. So we may suspect there is no that much injury to particular area, but whether patient we should send for the MRI, whether this patient we should send for the X-ray, how to take the decision. So without X-ray, without MRI, how you can treat the patient, that is also very, very important. One of the surgeon means every patient is coming, we are thinking only for the surgeries, not like that. So when the patient is coming, how we can treat this patient without surgeries. So without X-ray and without MRI, how you can treat this patient, that is very, very important being a practitioner. And the second thing is you should not concentrate the report of X-ray, MRI, CT, USG, whatever it is. Why? Because that is also in the commencing classes. I will give one examples each. Okay. And here, this is being an introductory class. I would like to give a brief introduction or brief idea about the X-ray and MRI, what is the need of X-ray MRI, how to prescribe and how to read, and what is the need of this present era. I think all of doctors are practicing. Usually, we used to prescribe the X-ray, but we may forget some technical terms or the views, etc. Why I kept this slide here? Usually, history of fall will be there, and when you are getting the X-ray or whenever you are patient, before you are sending for the X-ray, you have to think twice whether this patient we should take only epi view or else only lateral view, whether this patient we can take only in the angle joint only or shaft only, whether this patient we have to take the upper end also. What are the points we have to take or we have to concentrate while prescribing the X-ray? When the X-ray you are getting, everything we have to notice whenever you are going for the presentation treating. And this is, you can see this lady is around age is around a very small age, I think 19 age. History of hyperflexion. When she was playing in the here one park, suddenly, and she was moving fast and she thought to stop the in the park, and while just she give more pressure over the angle joint, there what happened, there will be hyperflexion of the knee joint. Because of this, patient got injury. Patient came in our hospital, we taken this history, there will be hyperflexion. So there will be getting chance of, because and patient is unrested, it is very easy, we may uh, so just hyperflexion or inversion aversion, if there is getting chance of fracture, that you have to notice and start reading today itself anatomy, and after that you have to read the manual of clinical. Thus I used to tell my students, even whether it is UG, PG or practitioner, whoever it may be, because whenever you are reading the injury wise, then injury examination, you will get to know if the inversion happen, hyper flexion or inversion, aversion, whatever it is, with more pressure, then there will be getting chance of the lateral malleolus. If inversion happen, the lateral malleolus of fibula, there will be getting chance of fracture. If it is hyperflexion, then there will be getting chance of fracture over the there will be getting chance of fracture over the medial malleolus of tibia. You are getting point? I think so many practitioners are knowing about this, but basic level. If somebody is having doubt, any other doubt, you can put in chat box also. And here you have to concentrate, you have to read today itself. The anatomy and the examination is very, very important. On the basis of history, you have to prescribe the X-ray. And whenever you are writing, you have to mention the right or left or particular area. And patient is having complaints of pain and swelling over the particular area, or else deformity is present. All those things you are in the patient present complaints, as well as what is the your inspection, what all the things is there, or palpation, whatever you are suspecting, that also you have to mention on examination. Obari you can put and you can write, then you write the X-ray particular area. So that will give more accurate X-ray you will get. Otherwise, the technician is much not that much expert. They are sometimes they are not asking to the patient how it happened. This another same case I got very recently. I think 1 year back. Not recently. Why I'm telling this one is very 2022, and we have so many patients with this type of fracture, and we used to tell the patient, if you are ready to stay here, then only we'll take, otherwise we will send. So without x-ray also we can read the bone structure, whether it is displaced fracture or not. So that also you have to cultivate the habit of reading without x-ray, how to read the fracture site and everything. That will comes whenever you are getting bored. That will remind me after 1/2 an hour. I will give the introduction how to examine the case or the fracture dislocation without x-ray, how we can identify. The Sushruta Acharyas explained very beautifully the slogas and everything that will decode and will explain, and how the traditionally we are approaching to that patient. That is also very important. Okay, so this patient, I don't know, this is a hyperflexion. The same another history, one of my cousin brother, he met just accident. It is only history of fall from the bike. Okay, and with his son also, and son escaped. He didn't got any injury, and he suffered the same fracture the site. I have another x-ray, but it is not there in the my phone. I think somewhere I will show you in the coming classes. And I taken this patient. I was alone in my city, and I taken this patient to immediately modern hospital. We have this opportunity to take X-ray. So here also near my hospital, there is a. It will be only 5 o'clock. We taken to the modern hospital. Why I am this telling this story means you will get to know the importance of the person, whether you are a doctor, whether you are a attender, whether you are a technician, whatever it may be. You have to use your common sense. I told this patient there is a history of fall. Patient is difficulty on the this area. Before going for the X-ray, I just patient came in ambulance only. He fell down from far from 10-15 kilometers from our hospital. This person told you called that person, other person, bring ambulance and you take to our hospital. Then we told we'll examine. You keep the patient in the ambulance only. After the examination, I came to know there is a crepitus sound. There will be in the lower end of the disc. Then I came to know there is a displaced fracture. And this patient I taken this patient to modern hospital. Then I told you, I am doctor. You just take this X-ray, AP and lateral beam. Okay, I have so many the slides and everything, but before reading the theory part, we should know the basic idea. At least 10 minutes, if you are hearing, you will get to know the importance. Some students or doctors and practitioners will get to know this importance. And I told this patient, here also you can notice, here we didn't taken any X-ray over the upper end. Why? Because there is a hyperflexion. There will be getting chances of the angle joint, and as well as in the lower end of tibia fibula and the shaft. There will be 99%. There will not be any chance of getting injury over the upper end of the tibia and fibula. But there will be history of fall is there or direct hitting is there, then you have to take X-ray over the knee joint also. Then I was examining particular upper end. Then there will be slight tenderness. I informed the technician and she told only the fracture is here. Usually the doctors will take only this area only. Then again, I discussed with another technician. She was expert in that, and she is also agreed with the my sentence. And she told, "Oh, okay, doctor, we'll take AP view so that we'll get to know the fracture." Because another technician told, if you are going once again the lateral view, there will be getting chance of difficulty. The patient may go for shock also. There will be severe pain like that. She was telling. Okay, I told we'll go for AP view. After taking AP view, there will be fracture, undisplaced fracture over the head of the fibula. So whenever you are prescribing the X-ray, you have to prescribe entire bone from the proximal shaft and the distal end of the particular bone. And the joint also, proximal joints also, distal joints also, you have to cover. If it is affected in the wrist joint, you have to take up this elbow joint also. If it is in the ankle joint, you have to cover the knee joint also. If it is patient is affected a hip, you have to take from the hip, lumbar. Likewise, nearer area we have to cover. That is very, very important. So this patient we treated with our Ayurvedic bandage only. Coming classes, if you are interested, whenever we are getting time, I used to teach you the some marma techniques and marma stimulation, everything. That also very quite interesting for you people. If you might have practicing this. Those who are not practicing or identification as marma, that is also very important. Sometimes people may tell that is affected in the marma sthana. That is why the patient is suffering from pain and swelling. No, you have to go for the examination. Then you have to confirm this patient we should send for the X-ray or not. Okay. And this patient we treated with our Ayurvedic management only. After 1 year, patient came another injury, the same leg with the history of Abhigata. So we taken this patient for X-ray. Till now, after treatment also, we taken only one X-ray. We examined through Ayurvedic Bhagnam Sandhi Manaviddam Mahinaga Manulbanam Sugajeshta Pracharam Cha Samhidam Sammikadishacha. After the examination, we will get to know the patient is having pain and swelling or the malunion, cross union, etc. So there is no need of X-ray because it will take 3 months, 6 months for the complete unity uniting. It will be start, but completely united it will be over after 6 months. Remodeling, modeling, etc. will come. You can notice this patient, the same patient after the Ayurvedic management, Anchana, Pedana with Marma Chikitsa and bandaging technique. You can see here tremendous result over the Ayurveda. That is the strength of Ayurveda. Why I am telling, you may think just how to prescribe X-ray, how to read the X-ray. No, that is not important. Being a practitioner, this is all the things is very important. How to prescribe X-ray means other than that, what are the area we have to cover, that is also very important. And after, whenever you are prescribing the X-ray for check X-ray, don't take the lateral view. That is very, very important. Before clinically uniting, you should not perform any this one before going for the X-ray. You should not perform any X-ray before after. This is very, very important. You see the injury on the basis of that. And when you are taking the X-ray lateral view, and there will be getting chance of displacement. Okay, that is also to keep in mind always. There will be getting chance of displacement whenever you are performing the lateral view. So if you want to check X-ray, take APV only. Very recently taken, when the class is coming, I will show you the one patient displaced Colles fracture. After that, we taken the X-ray, that also I will show you. Okay, it is completely reduced after the our Ayurvedic management, our bandaging only. Still patient is continuing. There is no other difficulty. So I will keep you one thing, and you have to prescribe the X-ray only AP view. Don't go for the lateral view before clinically united. Whenever you are getting suspecting or there will be getting chance of the displacement or something, it is not visible in the AP view, then you have to keep the patient in the position. But otherwise, the technician what will do? They will do testing. There will be getting chance of the again displacement. So that is keep in mind the how to the approach to the patient. That is very another point is one lady patient history of fall from the height. Okay, and while climbing the get down from the step, and there will not be any holding area, and when she get down over the steps and she reached here first floor, from first floor there will not be any holding that area also, and she fell down, she got fainting and she fell down in between this gap, and she got difficulty for breathing. She got injury over the ribs as well as in the spine area. And immediately patient came our hospital. I was not there. And after hearing this history, I came to know there will be direct hitting over the chest region. That will go for the pneumothorax and hemothorax. Okay. So immediately that patient, if you are going for the X-ray also, nothing you can notice. That patient you should go for the CT scan, then you have to rule out. Okay, and this patient fall from the steps and difficulty for breathing, pain during, and usually we used to do the Adangal Prayogam. That also I will explain whenever you are getting boring time. I'll teach you how to do the Adangal Prayogam. I'll demonstrate it. Whenever you're having any pair, that also you can do. And if you are suspecting there will be fracture, displacer fracture, and piercing the internal area, that patient you should not go for the any other Adangal Prayoga. And here anyone can notice the fracture. This patient, one thing I want to tell you, and this clavicle is not got fracture. Rib first as well as second, third, and here also second, third, rib first, both side, and spine also, the thoracic area, spine also got fracture. Vertebral body of the spine also got fracture. I'll show you. They've taken so many X-rays from the Calicut Medical College. 3 to 4 times they take. I think you can number this how many. One is and they taken in the 11-3, and another one 11-3 they taken in the 14. There's 2 o'clock, and another one they taken in around 11 o'clock, and another one they taken on the 12th. Okay, and 14th. All 3-4 times they taken, but there was no other fracture noticed after taking X-ray. Why you are taking repeated X-ray? There is no need. Take one time. If still you are getting the X-ray is not a adequate X-ray, then you can go for the second X-ray. And this is, notice you can this patient already we confirmed there will be getting chance of fracture over the rib as well as in the spine. Okay, the nature of the fracture. So that is very, very important. Nature of the injury is very, very important before you are prescribing for the X-ray or MRI, CT, whatever it is. So try to read the anatomy and try to read the examination. So other than that, you are prescribing the X-ray and somebody is taking without the proper knowledge of X-ray, that you will not get proper X-ray or MRI, whatever it is. MRI, the thing is, sometimes some people, usually I have one experience after writing the histogram MRI. And the big hospital was one of the big hospital in Calicut. I sent one patient for the MRI of histogram. After before going for the MRI, just he was also doctor, that patient, and we discussed, and all the MRI we have, then we did probing also. Then external opening was to 1 o'clock, internal opening was 12 o'clock. Just to confirm, is there any other extra opening is there or not? Then I advise this patient, go for the MRI, check another repeat MRI. After 2 years, the same hospital, I think same or another hospital he went, he taken this MRI. The report came, external opening was in 6 o'clock, internal opening is in the 12 o'clock. If I was seeing and I was doing the probing like this, what will happen? Entire buttock I have to cut, or IFTAC method I have to do. So blunder will come by USC and MRI, CT, whatever it is. But your clinical examination is very, very important. That's why I'm giving importance to this also. Okay. And you can see here, right mild pneumothorax, bilateral minimal hemothorax, multiple bilateral rib fracture, right pulmonary contusion. You can see here pulmonary contusion also. In the X-ray, you may not visible if you are not expert. Multiple vertebral fracture as described. So history of fall from the height. If you are prescribing only X-ray, patient is not able to sit, walk, and etc. Still the signs and symptoms is there, and I'll show you. I will tell you now itself. The fracture is there. Your history of fall is there. Then after taking X-ray also there will be, you are suspecting. You can go for the CT, MRI, etc. So you can take this sloga. Some students and even doctors are knowing, and I think some students you may forget the sloga. Shoidu bahulyam. Swelling will be the spandana. If it is displaced one, the spandana means shaking. Vivartana, if you are doing different movements. Sparsha, if you are touching the particular part, it will be more painful. Okay, at that time you can prescribe the X-ray. Spandana, Vivartana, Sparsha. Avapidyamano Shabdaha. Again, 100% is you have to prescribe the X-ray as well as CT, etc. Whatever it is needed. Okay, avabidyamano shabda. Srastangada, if it is affected parties will be completely srastangada, deformity will be there. Vividha Vedana Pradurbhava. If injury is there in the ligament, injury is there in the fracture, injury is there in the bone got fracture, injury is there in the any other joints like dislocation, subluxation, etc. Today also I got one patient. So you have to take the X-ray like that. And I want to explain another history. Day before yesterday, I got one patient. She was a history of fall from the shoulder, and she can do all the movement. After taking shoulder joint X-ray, there will be more gap over the shoulder joint in between the acromion process as well as the head of the humerus. But it the glenoid cavity head of the humerus, it will be the same position. What I did now, I advise this patient bandaging as well as I told you take X-ray both the right shoulder as well as in the left shoulder. Okay, we used to prescribe AP lateral view only the particular area. Whenever you are writing the X-ray over the hip joint, whenever you are writing X-ray over the shoulder joint, you have to take the both joint AP view. Then only you can compare with the sound one as well as in the affected one. You are getting my point? Okay, see like this, whenever you are getting doubt, send this patient for the another this one investigation like CT, etc., MRI, etc. Okay, coming to the interpretation, I want to tell you one thing. This interpretation, adequacy, alignment, bone, cartilage, disc, soft tissue. So we get to know only after seeing the X-ray. There will be only fracture, dislocation we can read. Am I right or wrong? Yes. Before going for depth of this knowledge, the people will understand, or people will think like this only. But here, once you are expert in reading the X-ray, you can read more over the injuries like fracture, dislocation. For example, there will be more spacing will be there. There will be two chances. I told no one X-ray. There will be subluxation of this particular joint, and another one there will be injury to the ligament or tendons. Tendons means there will be attaching for example in the shoulder joint, the supraspinatus muscle is attaching to the head of the humerus. There will be tearing or retraction will be there over the tendon. Then there will be spacing, there will be getting chance of along with the injury to the labral as well as in the ligament, then there will be getting chance of over the spacing over, you can see not only for the dislocation as well as subluxation, there will be getting chance of injury to the ligaments also more. So when after writing the particular X-ray, okay, for example, another one, if the patient got injury over the lumbar region or in the lower end of the thoracic region, upper end of the lumbar region, history of fall will be there. How while walking, slipping over the ground, then be direct hitting over the buttock region, then there will be getting chance of injury to the lower end of the thoracic as well as upper end of the lumbar. Then there will be more chance of fracture over the body of the vertebra because of compression fracture. So likewise, you have to read, then you can understand when you are writing only in the lumbar area, you may miss in the upper area fracture. And without the proper diagnosis, we may go for the kidney, dhara, etc. So any part of the body got injury, immediately we have to keep what we can keep immediately, whether we should go for the massage, whether we should go for the manipulation, whether we should go for the marma massage, I mean marma stimulation. What we will do? If any part of the body got injury, what we can do? Some people will think the sir is taking the X-ray class or something. Please put in chat box, somebody. As a first aid, what we can give? I think we got one answer. We'll check it. Yes, Dr. Sriram Monday. Okay. I will repeat the question. When patient, any part of the, not only the marmasthana, any part of the body got injury, it may be direct injury, it may be history of fall, immediately what first aid we can give? I think we have number of answers. Cold compression, that is very, very, Dr. Abhishek, ice pack, very, very, very good answer. Because even we have that type of knowledge, but our Ayurvedic practitioners, they are doing, immediately after injury, they are doing the kidi, dhara, then whatever they are doing, agnigarma, so many things they are doing. If you are watching the people, those who are doing the or playing the footballers, any part of the injury happened. I think when I was in child, I used to see this footballs and everything, wherever it is this, just observing. And when I was in high school time, I used to play also football. After that, we are concentrating only Kalaripayat, yoga and etc. Where it is more attention is needed my side and as well as in my family. So I was telling, I was observing the things. Immediately, any injury happened or hitting or falling, they used to do the normal movement is possible or not. Then they will take this patient for the or person for the outside of the ground. Then they will keep the ice pack or compression or simple tap water dhara we can pour over the particular area. You can keep the murivanna over the fridge and you can apply over the particular area as a first aid, because you are writing the prescribing the x-ray, then you are diagnosing. If you are not treating, not able to treat this patient also, you did this first aid, then you did ice pack, just give you are putting the small bandage over the particular area, and that will help more to that patient, because the accumulation of fluid will arrest. Okay, and there will not be bleeding also will arrest. Pain and swelling, pain will reduces, swelling also will reduces, and so many benefit will get after immediately injury. You are keeping the ice pack. If you are coming to the cold pack, hot application, there will be the formation of swelling will be to the area will be hardness, and there will be more this one bleeding also getting chance, and patient will not be able to do the normal range of movement, and there will be getting chance of increased rise of temperature also. Okay, so this is very, very important. So I will deal when the coming classes one by one or two I will explain here. Adequacy, you have to see all 7 vertebrae. You have to see this 1, 2, 3, 4, 5, 6, 7, whether this 7 is visible or not in the lateral view. And cervicothoracic junction, correct density, shows bony and the soft tissues, etc. You can see over this area. Inadequate X-ray. So just this is not the problem for the doctors. This is a problem from the technicians. So when you are getting this type of X-ray, you have to send this patient again for the X-ray, and you have to write this. You didn't. I didn't get this X-ray properly. This is inadequate X-ray. You have to take this cervical vertebrae from 1 to 7. It should include. Okay, and this is also very, very important. And the alignment, when you are getting X-ray, the lines should be follow the slight lordotic curve. This is also very important. So any relatives, I think some students or doctors, everyone will get, sometimes they will give immediately the X-ray or MRI. Doctor, idonnu nokku. In Malayalam, we are asking the people. In Kannada is there? Anyone? Karnataka is there? Anyone is from Tamil Nadu? Anyone is from Karnataka? Anyone is from other than Tamil Nadu, Karnataka state? Karnataka. Okay. ಕನ್ನಡದಲ್ಲಿ ಏನು ಹೇಳ್ತದೆ ಮಾರೆ? ಕನ್ನಡದಲ್ಲಿ ಹಲೋ. ಇದೊಂದು ನೋಡಿ ಮಾರೆ, ಇದರಲ್ಲಿ ಏನಾದರೂ ತೊಂದರೆ ಇದೆಯಾ? ಇದಕ್ಕೂ ಇದು ಏನು ಮಾಡಬೇಕು? ಇದು ಆ್ಯಕ್ಚುಲಿ ಇದಕ್ಕೆ ಡಿಸ್ಕ್ ಏನಾದರೂ ಪ್ರಾಬ್ಲಮ್ ಇದೆಯಾ? ಇದು ಡಿಸ್ಕ್ ಇದರಲ್ಲಿ ನೋಡಲಿಕ್ಕೆ ಆಗ್ತದಾ? ಎಲ್ಲ ತುಂಬ ಕ್ವಶನ್ಸ್ ಅವ್ರಿಗೆ ಕೇಳ್ತಾ ಇದೆ. ಸೊ ದ ಪೀಪಲ್ ವಿಲ್ ಆಸ್ ಡಿಫ್ರೆಂಟ್ ಟೈಪ್ ಆಫ್ ಕ್ವಶನ್ಸ್, ವೆದರ್ ಯು ಆರ್ ಕೇರಳ, ವೆದರ್ ಯು ಆರ್ ಇನ್ ಕರ್ನಾಟಕ, ವೆದರ್ ಯು ಆರ್ ಇನ್ Tamil Nadu, whether you are in abroad, anywhere the people will ask you whether what are all the things we can able to see here, or else what are all the deformity can you read from this. Okay, so you have to expert in that. That's why you came here. The people, I think the Prabodhini also, their aim also, the sharing the knowledge, what the people need present era. Okay, this is also smooth, you can see here, and this without any step off and stepwise deformity due to ligamentous injury or an occult fracture. I told the ligament injuries also will be difficulty and hyperflexion, and some people will go for the manipulations, different type of manipulations. I'll show you 1 2 3 other slide x-rays. So you have to think twice before you are going for the manipulations in the cervical region. I used to do the cervical. If time permits, the coming classes, when you are getting bored, I used to give training for the how to do the manipulation in the different, especially in the spine area, that we will give you more. And one thing, one point is there, if you got patient immediately, even the neck is like this also, completely turned one side also, you take history properly. First, initially I told. After that, inspection, palpation, then active as well as passive movements of the particular area. Then you can go for the marma stimulation and manipulation. If it is reducing the pain, as well as patient is comfortable with the after your stimulation and manipulation is not a vigorous one, just traction is enough, patient is getting comfort, then you can confirm that this patient is no need of sending x-ray, MRI, etc. So upashaya and anupashaya also will act. So I want to tell you, if you are in sending this patient in your X-ray center, because you need patient also. Okay. And another thing is, if you are not sending this patient, your clinic or your hospital, this patient is going for outside, you are not getting any benefit, then why you are sending this patient for the modern hospital? Sometime the patient may not come to your hospital. Am I right? So you have to confirm the patient after the examination. This patient, if I am sending X-ray now, patient may not come, and moreover, this patient this time it is not needed, and go for the stimulation everything. Then prescribe the medicine and the X-ray, prescribe the medicine everything, and lastly after that you can tell the patient, if it is more pain, if you are feeling after before coming here, you while coming bring take X-ray and come with the old reports, like that you can tell. Okay, don't send whenever you are getting patient immediately to the X-ray center for scanning. If you are X-ray center, then the patient will come back. Otherwise they will when I was 2 days before, I prescribed one patient for colonoscopy, not sigmoidoscopy, and USF abdomen. Already this patient already this taken this one OP card, and I prescribed examination. I did examination, and there will be pile mass and etc. Then I told you will go for Char Sutra. You take one sigmoidoscopy and as well as in the USF abdomen. The same college, same management, they went to other hospital, modern hospital. They told you take another. I'm not blaming anyone. I'm telling here the truth. Even if it is Kerala and Karnataka, they told the doctor was asking after the consultation. Okay, you take the this one consultation. Then the doctor was asking that patient, why you are going for the Ayurveda? Allopathy is very good, no? This is having good result. Why you are sending for this patient? I'm telling, even if it is in the same institution, don't tell anybody. But I am telling here, the truth is like that. Anybody, if you are sending for the X-ray and MRI, that they will give some counseling to this patient, and you may miss your patient. So you try to study all those things, and before you are sending immediately for the X-ray center or MRI center, you treat with your patient and medicines and your techniques, and keep it with you. Afterwards, you do go for the MRI, etc. Okay, and coming to the, you can see here this alignment. This is the body of the vertebra. You can use. You see here. This is the spinal canal. You can see here, and this one is another the arch. You can see here both the spinous process, and seventh one you can see the cervical prominence. And misalignment. After reading like this, you can notice here the misalignment over here. So this is also very important. The side you have to see. Whenever you are reading the rib also, you have to read like this. So everywhere, first you have to study anatomy, normal one, and this point likewise, and different diseases. Okay, the bony landmarks you can see here. Bony landmarks you can see here. This is the first one, and the body of vertebra, how it will be like this: 1, 2, 3, 4, 5, 6, 7. Vertebral body should be rectangular in shape and roughly equal in size. Anterior height should be roughly equal posterior to height. And I think I used to explain the different area. In the cervical is coming, cervical as well as thoracic, other doctors will deal, and my session also I will deal another areas, and joint injuries. And why I'm telling this is a brief idea you should have. Once you have brief idea, you can go step by step. That way this session is arranged, Prabodhini's session is arranged. Okay, and after finishing this, you should be able to read the X-ray, and whatever the confusion you are having, you have to discuss with the different faculties. Okay, and here bony landmarks you can see here. This is a lateral mass and double line facet joint. You can see here. This is a lamina. Sometimes there will be fracture over the lamina also. History. So you have to see the lamina, the history of fall, hitting, direct hitting over the particular lumbar region. You have to see properly or thoroughly. Keen observation is needed. Spinous process as well as lamina and pedicel, etc. Whether it is fracture is there or not. And this is a rheumatoid arthritis. I told just now, if somebody is getting, you are getting any type of patient, what you will do? You will do this manipulation. What will happen? This manipulation will lead to complications. Here you can see here. This type of rheumatoid arthritis patient, you are going for manipulation. So whenever you are suspecting this patient before, when you are doing the manipulation or any other type of treatment in the neck region, and you are suspecting there will be arthritis, go for X-ray, AP and lateral view. And if you are suspecting like this, don't do any manipulation, and you treat with the which type we can treat, Uttana or Gambira. What we can treat, which level we can treat? ಹೇಳಿ ಮಾರೆ, ಯಾವುದು ಲೆವೆಲ್ ಅಲ್ಲಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಬೇಕು? Whether we should perform the superficial or deep? You have to treat Gambira level. Okay. Spinal canal stenosis, another one. So when you are getting any type of patient, simply without proper examination or history taking, proper examination, proper investigation, you should not go for the final diagnosis. Why? We may get this type of cases. Usually in the OPD level, we are getting arthritis or cervical spondylosis. We will tell only cervical spondylosis. In Malayalam, in our modern doctors, usually they will tell teni poi. If your age is more than 50, they used to tell amma allegil acha ningale vayas etrayi, your age is more than 50. So there will be teimanam, there will be degeneration. Okay, you keep in mind always, not only one sentence you can keep cervical spondylosis instead of cervical spondylosis. there will be more number of diagnosis will be there, and come to the accurate or final diagnosis before you are going for the complete main management. Like if it is in the external therapies, confirm with the history taking, examination, and the X-ray or MRI, CT, whatever it is needed. Okay, this is a spinal canal stenosis. You can read here. Okay, as MRI also you can see here. And this while reading the X-ray you may not get this idea. And this is the canal, this is a spinal cord. And how many of you are able to explain where it is the spinal cord is starting, where it is ending? As a vertebra level you have to tell. Then one thing I will tell you. If you are telling that answer, don't seek any books or Google something. Directly from your brain I want. Whenever I am teaching my students also, I will not give any imposition. I will ask the students the same thing. You tell me from your opinion, from your brain. How many of you are able to tell the spinal cord where it is starting and where it is ending? Whether is it possible to see in the X-ray, whether it is possible to see in the MRI? അത് പഠിക്കാനാണല്ലോ നമ്മൾ ഈ ക്ലാസ്സിൽ ജോയിൻ ചെയ്തത്. Why we came here? For study purpose. Then you are asking to us, just tell me the spinal cord where it is starting and where it is ending. That you came to know already. I'll tell you one point, big point. There is a one big point. I think everyone went for the food. You are busy with your. No answer is coming to the chat box. Doctor, കേൾക്കുന്നുണ്ടോ? Am I audible?
Yes, sir, audible.
No one is putting answer. You just think spinal cord where it is starting, where it is ending. Whether it is right or no problem. You send me personally. You can send through personal also, no? Not everyone put in personally. For me or madam. Starting from C1. Okay, very good. C1 starting. Ends in L4, not L4. Ends in 11. So I am asking, why I am asking here, if you got any history, okay, cranial got, okay, you can put your idea there. Why I asked this question? If I am asking like this, then only you will think. Otherwise, what will happen? You may tell to the patient there will be fracture in this particular area, then it will connect to the spinal cord. You may tell. If once I asked, then you will go through today itself, then you will get to know where it is starting in the adult, where it is ending. In the child, where it is starting, where it is ending. Okay. So this, any area, history of fall from the height or slipping, then the pressure will come more over the lower part of the thoracic region, upper end of the lumbar area, around the L2 areas, lower border of the L2 area. So in this spinal canal area, the body of vertebra got fractured. This is not a spinal canal stenosis. I am telling another one, spinal cord I saw from this area. That's why I'm telling. Okay. When the body of vertebra got fractured, I already told, and this got compressed, then there will be fragments also will be there. And that fragments will compress over the spinal cord, and there will be getting chance of the paralysis over the lower limb. So whenever you are getting, if it is undisplaced condition, treat it with complete bed rest and you put the bandaging with the traction, and that will be completely healed within 3 months. The body of vertebra will heal, and after the remodeling and modeling will come after 6 months and 1 year. If it is retropulsion, or there will be fragments will be there, and that will be pierced or compressed over the particular spinal cord area, and that will lead to the paralysis. I told initially, I'm repeating The same thing, if you got any type of patient with the history of fall, you are suspecting, take X-ray. If it is in the lateral view, there will be a size is reduced, then go for immediately CT or MRI. Okay. So this is also very, very important. Anatomy is very, very important whenever you are going for the, especially in the treatment aspect. Just if you are prescribing the medicine, it's okay. Even the patient is a Kasa, Shwasa or something, whatever it is. If you are treating with the Panchakarma and before going for the Panchakarma, whether this patient is or Purvakarma, Kidi, Dara, whatever it is, instead of all is there, this patient we should go for the X-ray is very, very important. Once the clinically uniting started, then Vagnanandara Chikitsa you can do. Okay, this is also a kind of spinal canal stenosis. You can usually this type of patient is very more popular area. This is a compression fracture. Just I have told. You can see here the size is reduced. Body of vertebra you can see. Notice here. This is also compression fracture. Okay. So these are all the diagnostic mainly in this. In the practical X-ray, you have to see. In the MRI, the patient is having neurological impingement over the lower limb. Patient is complaints of low back radiated to the lumbar area. So what are all the tests we can perform? One is a SLR test. Another test is Lasigutis test. Then femoral nerve stress test. So many tests is explained in the textbook. Okay, then you have to confirm it whether this patient we should perform the MRI or not. And there will be disc bulge. Now we have one patient, I think 1 week before patient came here, even after 3-4 days hospital admission, they underwent the injections and modern management medicine medication. Patient was not able to walk, sit, even sleeping also. Patient came in our hospital. We did traction with the stimulation over the lumbar area and the entire limb. And we used to do the simple bandaging, and 1-2 times we used to put the traction also. And this patient was telling there will be, MRI was explaining L4, L5 disc excrusion. Tell me the stages of the disc herniation. There will be disc bulge, disc protrusion, disc extrusion, disc sequestration. So when you are reading the X-ray, whether you can read the you can read only the structure, whether you can read the disc over the X-ray. When you are reading the MRI, you can see the disc, whether it is dehydrated, whether it is a disc bulge, whether it is a disc protrusion, whether it is a disc sequestration or lumbar IVDP. If you are seeing in the not only in the IVDP, listhesis condition also, you can, whether it is grade 1, 2, etc. You can notice. So that if you are suspecting through after taking X-ray, then you can go for the MRI. No need of sending all the patient for the MRI. Okay. Coming to the joint MRI also. Joint, I think people will come to history of fall or sports injury over the knee joint. We used to advise this patient go for the MRI, particular knee joint, right or left. And after that, we have to see whether it is partial injury, whether it is grade 1, 2, 3. On the basis of that, we have go for the management. And I told initially, you can't send all the patient for the MRI. For that purpose, we should go for the examination. What are all the tests we can perform in the knee joints? Anterior test, posterior test, Lachman test. This way you have to confirm whether this grading, on the basis of grading, whether this patient we have to confirm with the MRI. If patient can do all the range of movement, there is no locking, there is no other shaking, patient can do all the range of sit up and standing and everything, slight pain is there, then there will be minor injury over the medial collateral ligament or medial meniscus if it is in the medial side. So the structure of this particular joint is very, very important. And the examination also is very, very important. Why I am telling very, very means that is 100% is important one. Without this, just you are sending sometime very poor patient, can't send for the MRI, it will take around 3,000 to 5,000. Just if you are reading from the X-ray, you can't read the injuries. Okay, likewise, all those things. The brief idea about the diagnostic techniques, I think you all are aware of this. I will go through this one. X-ray, February 10th, 1923. Okay, Röntgen, he's invented. Röntgen outside of Germany. 77 Germans who was the first discover reproduce X-ray in 1914, won the first Nobel Prize in the physics. Okay, so this race is passed here. So this is one main point from the X-ray. He accidentally discovered X-rays in November 1895 while studying cathode rays in a low pressure gas discharge tube. After that, Röntgen placed various objects and how it was between the tube and the screen. Screen still glowed, and finally he put his hand in front of the tube and saw the there will be his bone projected on the fluorescent screen. So likewise, somebody can do some innovative ideas or techniques in the present era by using the AI or and your brain also more than enough. And coming to the basic X-ray physics, X-ray are electromagnetic radiation having the low wavelength from about 18 to 10 to 8 to about 10 to 11 m therapeutic X-rays and diagnostic X-rays. We all are knowing the X-rays, different way we can use. X-ray can pass all the way through the body, be deflected, scattered and absorbed. And here diagnostic purpose also, then therapeutic purpose also, this one is we are using. X-ray is the most preferred tool to determine any bone-related problems such as fracture, tumor, degeneration. It is also used to detect other cases like pulmonary tuberculosis, lung abscess, etc. Therapeutic uses, it is used in cancer treatment to kill malignant cells. Asking for an X-ray prescription, before asking for X-ray, following point should be kept in mind. I told initially, both AP lateral we should be taken in most of the cases. Special views sometime we may advise to the particular patient. And special views sometime people are not aware of this, and you have to tell the technician whether they are expert in the particular view that you have to analyze or ask the person. X-ray requisition must specify the area of suspension. Immediately after my UG, I started practice in Talasheri Hospital. So one of our staff, his wife was working. Still, she is working in that same hospital, modern hospital, X-ray technician, and she asked her husband, who is that person? Usually the person will write particular ankle joint or wrist joint, only that area. But when I was writing the wrist joint means, I used to specify in the bracket right wrist joint, bracket scaphoid bone or lunate bone, etc. Or base of the fifth metacarpals or the base of the first, second metacarpals or shaft of the metacarpals. If it is in the tarsal bones, calcaneum, or angle joint with cuboid, angle joint with the navicular bone, angle joint with the medial cuneiform bone, or second metatarsals, etc. You have to specify the particular area. And one thing you get to know, one point, whenever I'm telling, some people are doing like that also. Some people are not writing just angle joint only or write foot only. You may not get proper area. Exact location. So you have to specify bony area also. For that, you have to start reading the anatomy, particular bones name, area name also, whether it is proximal, distal, etc. Okay. And X-ray of the pelvis in both hip should be asked for in all cases of pelvic injury. I told initially, and there will be history of fall will be there and direct hitting over the pelvis area, then there will be getting chance of fracture over the pelvis also. For an X-ray evaluation of the hand and foot anterolateral oblique view is very, very important. Metacarpals and metatarsals area we used to prescribe which view? Metacarpals and metatarsals lateral view. No. Which view we can write? Oblique view. Metacarpals and metatarsals. If wrist joint, you want finger, even fingers or metacarpals and phalanges, metatarsals and toes, we used to prescribe AP and means oblique view. AP and oblique view. This is the X-ray machine. I think that one everyone is knowing. And two views there is a one is abnormally. So many things are one by one area. If it is coming, I used to explain the role of X-ray to confirm diagnosis that everyone is knowing. Okay. Anterior posterior view, oblique view, the scaphoid view we can take. The scaphoid fracture is there. Okay. Patella skyline view, the calcaneum axial view we are taking. Okay. Okay, this is also very important. The wall of the clips for hanging. So if it is needed, then only we can keep our X-ray. Ulnar shaft fracture, and this is the another fractures you can see here, different areas. Osteoarthritis knee, you can see here. This pathology also you can read by X-ray, whether it is a grade 1, 2, 3. After seeing the deformity and X-ray, you can analyze. And this is also very important. The scoliosis, you can see here the AP view, lateral view. If you are getting any scoliosis patient, pain over the thoracic region, especially in between 10 and 20 age, the ladies or gents, whatever it is, and you can take the thoracic as well as in the lumbar area. Thoracolumbar, X-ray, APN. Then you can see the kyphosis, scoliosis, etc. You can see this is the fracture. Usually, first we will go for the X-ray to rule out the fracture. After once a clinically uniting 0 to 7 day hematoma, after hematoma soft callus formation, that is a second week to 12th week. Okay. In second week to fourth week soft callus formation, fourth week to 12 week hard callus formation. Likewise, you can see. If you are prescribing the X-ray, you can see the callus or clinically uniting in the fracture patient also. Callus formation you can see in different conditions. So advantages are relatively CT scan is more expensive. Equipments are readily available in most hospital, many doctor office. There is a small clinic also. The power is used in X-ray therapy to destroy the diseased skill also. Sometimes therapeutic purpose also this X-ray is used. Sometimes there will be diagnostic purpose. Disadvantage, X-ray involved exposure to radiation, which has cumulative damage effect. One of the danger in use of X-ray is that they can destroy living tissue and can cause skin burns on human flesh exposed for too long time. Indication for X-ray. Suspicious of fracture and dislocation. To detect lung pathologies, deformities of bones, intestinal perforation obstruction, to detect foreign bodies and abdominal injuries. And foreign bodies. One of my daughter, I have four daughters and one boy. And second one daughter, age around 1.5 years, and she was playing with the coin and some other instruments, and she taken coin from my this one, you know, shelf was there very near. She was able to take that, and what she did, she kept in below the this one our bed, no. And when mother came, my wife came, and she was searching. So many coins was here, but now one or two coins is missing. Only two or three is here, and she told we'll take for the X-ray. Then I told, after taking X-ray, I came to know nothing was there. Then I came my home. Then I searched, just I lift that table, bed and everything, and she kept the side of this uh, bed, two coins. Okay, so if you, whenever you are suspecting this type of any foreign bodies in the child, usually they wish to this one, or else some any other suspicious or policeman or someone, they used to take this type of X-rays. And the advance of this X-ray is CT scan that the people are knowing about, aware of this. Okay, and this is a highly danger if you are performing more time. Okay, and coming to the magnetic resonance imaging. Okay, and this is a anybody taken MRI? I told just now, one of my staff also, she went for the she was in now she's working in a OT technician, and she fell down 6 months back, and now she was not able to sit properly, and I advise you go for the after examination. We did bandaging also, it was reducing, but we need more perfect more time to work, and as well as to the this one doctors or staff should be perfect in this healthy, then only we can perform the, we can treat the patient. And this I was seeing this patient, I told whether during the procedure time how you felt, and she was telling she slept very nicely. The same thing I also did during my means I think 5 years back. I taken this one MRI in the lumbar area, and this, I entered, I slept very quietly, or slept without any fear. You have to give confidence and as well as assurance or brief idea to the person, those who are going for the MRI, because the sound waves is coming more, and that you are aware of the brief idea and everything. Earlier named as nuclear magnetic imaging, it can be plain MRI or contrast MRI, that you have to specify whether it is contrast MRI or plain MRI. Okay. And useful of MRI, it is very useful in intracranial, spinal and musculoskeletal and lesion including the joint pathologies. It gives right anatomical section of the area and the lesion of high resolution. MRI angiogram, and it is done without injection IV onto contracts. MRI fistulogram also we are taking. MRI breast used to multifocal recurrent cancers, magnetic resonance, and all those things. It is very useful in this particular conditions. And advantages, and there is a disadvantage, availability of cost factor it is sometime, and that type of patient you can send for the UST of particular area also. Okay, the shoulder joint for example, knee joint, but we may not get complete proper uh, idea about the particular joint. Patient compliance very poor. It is very feasible to the patient suffering the fear of the particular MRI. And I want to tell you one thing, MRI, X-ray, don't read just reading and treating the patient. No. If you are treating to the patient in Tamil, they used to, you should not treat the the person നിയലിനെ ചികിത്സിക്കാതെ നിജത്തെ ചികിത്സിക്കൂ. That means you should not treat the person who's walking night time. You will get some shadow. Okay, you have to see the person. Likewise, just concentrate examination and the along with the treatment, just whenever you help of the treatment or diagnosis to confirm the diagnosis, you can send for the x-ray, MRI, etc. Okay, so this is a brief idea about the MRI. If I started means we have a lot of things to discuss in the joint wise MRI. And whenever you are getting injury, the meniscus as well as in the ligament, what are the ligaments is present, brief idea will give. And after that, how we can read the joint MRI, and as well as in the knee joint, in the shoulder joint, especially in the other area, even some other case discussion also. And in the orthopedic condition, how we can prescribe the x-rays, and what are the views we can take, extra view. So many things we, in the coming classes we will take. In the coming other doctors also, especially in the MRI, in the spine and etc. area, they used to teach the anatomy and the different views of this. Any type of patients you are getting, how to read the x-ray, how to read the MRI. After finishing this class, I hope you people can read, because that much depth of this knowledge, and moreover not in the stipulated time, it is made a wide time, means more classes as well as wide range of knowledge you will get. Okay, thank you. This is a brief idea about the our anytime, any doubt you are getting, you can ask me. And if I'll be 9496809599, if I'll be free, we used to help you to treat the patient, not just simply, I think, use Prabodhini, a team also. I think their vision is the doctors immediately, they are even our students or some doctors used to ask every time, doctor, can you read this, show me this x-ray. Within 1 day or within 2 days or within 1 week, it is not possible. But this way, if you are getting the knowledge step by step, then next, if you are practicing seeing different type of x-ray, you definitely you will be able to read the x-ray. Okay, thank you. Doctor,
Yes, sir.
queries എന്തെങ്കിലും ഉണ്ടെങ്കിൽ, any
Is there
queries?
any queries? Please ask.
The coming classes will give the deep knowledge, as well as definitely if, whenever you are getting bored, I used to give the training of marma identification, examination, whatever briefly you want. I told no, some area how nighttime patient is coming. For example, pulled elbow case you got. Whether whether is there any needed X-ray or not? Patient complains of mother is or somebody is pulling the child hand, especially the wrist joint. There will be difficulty for the flexion, then the normal range of movement. Patient was not able to sleep, and continuous crying was there. And how you can manage this case? Whether this patient need X-ray. So likewise, so many things you will get number of questions once we are starting the classes, and that we can clarify one by one class itself. Okay. You can unmute and you can ask. That is better, I think. Dr. Gigi George. If a person complains of pain over the anatomical snuff box area, what view X-ray will be preferred? That we are told already. Anatomical snuff box area, there will be history of fall will be there, fall on outstretched hand is there, you have to see the lower end of the radius first and the ulna, styloid process. There is no other fracture. Then you have to take the X-ray over the right wrist, right or left wrist joint, and if you are suspecting the scaphoid fracture, you can write the scaphoid view also. The slight deviation to the lateral side, you can suspect. If you are suspecting the fracture over the scaphoid, then you can write the scaphoid view. And one thing I want to tell you repeatedly, you have to take another repeat X-ray after 10 or 14 days. If you are again after you started your bandaging or POP, whatever it is, after 10 days or 14 days, still patient complains of pain on the anatomical snuff box and as well as in this area, proximal part of the wrist joint area. In the lateral side is the in front of the lower end of radius, then there will be fracture over the scaphoid. Okay, I think GG doctor, it is clear. We can go for the scaphoid way. Any other queries? For a person who had angioplasty 3 to 4 years back, which tool is better, X-ray or MR? So today evening, after I came from my college, not my college. My college means I am working in college. So I came in our OPD, my hospital, and first patient was waiting. I think 3:30 the patient was waiting, and they did not only the angioplasty, bypass surgery they did. Okay, and he came from abroad. 6 months he was in abroad, and he was not able to lift the particular limb, and taken only USG of the particular shoulder joint. And there will be suspecting injury to the subscapularis area and the partial injury to subscapularis tendon. And the entire limb was completely swollen, and there will be this type of patient. If your person is having difficulty, then better you go for the X-ray only. X-ray also radiation is there, and CT also radiation is there. But if the patient is having more difficulty, first you take the person where he is treating that particular doctor, he should take the permission whether he is taking even Ayurvedic medicine, Ayurvedic treatment, any other investigation. That is also very important. Pregnant lady also very, very important. Okay, before you are going for the X-ray. Any other can ask any type of questions. Doctor, who is a SS? Patient has severe shoulder pain, neck and right hand. MRI report, impression, loss of cervical lordosis. Okay. Degenerative diffuse disc bulging with central left paracentral disc herniation. Identity on the thecal sac with narrowing of left neural foramina. Degenerative bulging with central paracentral disc herniation C5C6 area. And degenerative disc bulge, thecal sac mild narrowing, neural foramina, marginal orchiophytus, spinal canal stenosis, above the compressive myelopathy, pain spine swelling, degenerative bulging, L4, L5 bulge, marginal osteophyte, mild canal stenosis. Okay. No significant cord compression in dorsal region. What should we do? Okay. This patient, even 1 week before, I consulted one patient through video call. He's a Bangladesh patient. Now he's working in Qatar, and he's a given medical report also. After examination, he was suffering. I told no canal stenosis. That's one poster, one slide. The same way, he was just I was seeing, observing the canal space also reduced to 6 and 7. But after the examination of this patient can turn right side, left side, turn up and lift up and down, and he was able to bend his lumbar area. Patient can do all the range of movement. There was no problem at all. Okay, I'm telling here, even no significant cord compression in the dorsal region also. You have to see this patient clinical examination, inspection, palpation, active as well as passive movement of the normal uh, person. Even though if it is a normal person, you have to examine the affected side in the cervical region and the lumbar region. Then you have to confirm it whether this patient is the same problem is there in the MRI the patient is having suffering from. Then you can go for the first inflammatory phase. Second, this one to reduce the Vadahara line of management. And third stage, you can go for the inflammatory phase. And the fourth one, you can go for the this one, PDCL like treatment. And fifth step, you can go for the Shastika Sharipidasa, the like Brahmana line of management. Along with this, mainly there will be Vadasthana. To reduce the Vada, you can give the another Basti line of treatment, Vada, with Taila and the Kashaya Basti or Vaitarana Basti. That is also very, very important. Okay, even there is a osteophytes we can't do, and canal stenosis is very important. Even if it is canal stenosis, you can go for the Ruksha Sweda first, and then Snigdha Sweda, then Ruksha Snigdha Sweda also you can go for. And along with the Ruksha Snigdha Sweda, you can go for the Basti also. Shoulder pain, the patient, you have to see this range of movement, is it possible or not? Whether the involvement of shoulder or there will be because of the neck region whether patient is suffering from this complaint or shoulder pain, that you have to clarify before you are going for the management. If any queries is there, put in chat box, or else you can unmute and you can ask. Dr. Suryanash Yadav, can you read the MRI report? X-ray. 1 second. Usually, this is our actually our this class is not the treatment class, only the X-ray reading, MRI reading. But even we are having this type of question, we can discuss. Can you read? I am not visible properly. If I am making this more visible, okay. X-ray both knees. Okay. X-ray both angle. X-ray LS spine. I can read only this much. Can you? If you okay, we'll discuss further. Okay. If you are able to tell the what you they wrote in the small letter, no, you just put in chat box the what they asked in the main point, or else you unmute and ask. Now I can. Bones of the knee were osteoporotic. Osteoarthritis changes evidence of springing tibial spine, articular spine, and there will be reduced medial joint spaces. Patellofemoral articular are also involved. So both knees there will be osteoarthritis they are present. Okay, so articular spurs will be there because of the osteoarthritis, and loose bodies we can reduce the medial joint spaces because of the loose bodies. So I think there will be grade 3 or 4 patellofemoral articulation are also involved. Okay, there will be osteoarthritis severe more than grade 2 and 3, and X-ray both angles lateral view and bones are view osteoporotic and show both anterior and posterior calcaneus spur also we can see here. This patient is age is around 51 and no other joint space are viewed. So here as calcanea we can see in the angle joint lateral, both angle joint there will be calcaneum spur we can see. You can go for the Agniarma in that treatment. And this spur osteoarthritis we can go for Lepana, and we can go for the this one. Bandaging is also very important, and that will give that will reduce the pain. And another one is the X-ray lumbar spine AP lateral view, lumbosacral transitional vertebra with the possible sacralization. Sacralization we can give for the go for the leba, dhara, and bandaging also. Subtle anterior listhesis over the L5, and that is also one of the grades also we have to notice is there is grade 1 or 2. If it is grade 2 also, you should not go for the another complication. Vertebra in the view osteoporotic and the marginal osteophyte sclerosis, and there will be spondylosis. Okay, in the lumbar region. Clinical correlation and follow-up is advised. That sentence you have to read. There will be clinical correlation is very, very important whenever you are getting any type of patients. Okay. Any other queries? Doctor? For fracture, immediate management, ice pack, as sir said. Okay, according to Ayurveda, Ruksha Shida or Snigdha Sheda should be done. Does Snigdha treatment at first course? No, no. As per Susuda Chikilsasthana, Acharya mentioned there will be, even if it is in the Bhagna, before going for a Stabhana Bhaya, that is reduction, he mentioned as there will be Shidha, Lepa, Dhara. Okay, so not any Rusha one. He mentioned only Shida only. Okay. So another area also, any part of area got Abhigada, immediately we have to go for the Shida Dhara Lepa only. Does the treatment first cause more damage? No. There will not be any other hot application Acharya mentioned. Acharya mentioned only Shita, Lepa, Shita, Dhara, etc. Even whenever you are putting the bandaging also, you should not take any other Ushnavirya drugs. Whenever you are putting the Lepa, you should not keep any other cotton jukadile. You can keep the Eladi or Shida Shodahara, like drugs you can select. Burns case, sir, can you advise some treatment? Burns means you can treat the patient burns, but you have to see the percentage. And moreover, the particular area is, which area is also mentioned, area is affected, that is also very, very important. Actually, this burns also in this class, we are going to explain only the X-ray MRI. Even the burns is not a part of this, but you can go for the last, I think 3 days before near my hospital and home. One person is preparing the samavar, they are boiling the hot water, and that person entire abdomen, he was such a obese person, entire abdomen got burned, and patient came in our hospital. I given only Shadadauta Kritam. It reduced. But the bone burns percentage was not that much. Only abdomen is affected, not any other private area or any other more complicated one. Okay. Any other queries? Doctor,
Yes, sir.
എന്തെങ്കിലും questions ചോദിക്കുന്നുണ്ടോ ആൾക്കാര്? You can ask. People can, those who want.
If any queries, kindly ask. Otherwise, we can wind up the session.
Shatadautakritam you can apply, you can advise the patient 2 or 3 times. Yes, external application. Any other queries? Then you can ask. The opportunities, whenever you are getting, utilize the opportunities and read more and practice what you studied. Whenever you are getting any x-ray, try to read different x-rays, and very easy to prescribe and very easy to read the x-ray in front of the patient. If you are keeping the x-ray, if you are reading and if you are explaining to the patient, because these people are aware of this. Sometimes after a consultation from the modern doctor or expert, then there people are coming to you or somebody, and the same question they will ask to you also. Okay, if you are not able to give answer, then the people will get to know this doctor is not aware of my disease. Okay, after you are expert in the knowledge of this type of Ayurveda as well as modern, then people will get confidence on that. Okay, so can you suggest a book of radiology? Radiology, you will get so many books, but I want to tell you one thing. Anybody read from the radiology book or something, whether the person can practice this by reading just radiology? No. Just this type of classes will be useful because you will get to know different x-rays or technique, how they are prescribing, what are the things we have to take care, or anything, anytime any difficulty is there, you have platform to ask. Or if you are coming classes, if any patient is treating, if you have so many doubt, that also you will discuss. Case discussion is coming, so coming classes that will help you more, because just listening and what PPT is sharing is not like that. This is a discussion also will be coming, case discussion. So that time you can give your cases also, put it previously, put in a group or give to your doctor, and doctor will give to me, and that will discuss. That is also good for improving your knowledge. Okay. Doctor?
Yes, sir, we can wind up. Thank you so much, sir, for that truly superb and insightful session. And it was great honor to have you with us today. And the session was really helpful and inspiring for all of us. And a big thank you to all our dear participants for your time, patience, and positive energy throughout the program. For those who wish to join the Prabodha program, all details will be shared in the group shortly. Once again, thank you so much, sir. And thank you
Thank
everyone
you.
for being part of this beautiful session. With gratitude, Team Amogatri.
Thank you. Good night. Namaste.